Lower extremity regional syndrome can be caused by a number of different factors. Let's just start with the hip, because it's a very prevalent joint. It affects a lot of people. As we age, we all develop a bit of hip arthritis. And OA is clear and above the greatest cause for hip pain. There are also other conditions, and we like to look at the hip in three dimensions: the anterior portion, posterior portion, and the lateral portion. By viewing the hip in compartments, we could better understand where the pain is coming from. Viewing the hip in terms of the anterior portion, we do know that osteoarthritis and degenerative arthritis is probably one of the most common causes of hip pain. Laterally, viewing the hip laterally, very often a patient will come in complaining, saying, "Doc, my hip hurts me right here." And you point on it and the patient jumps. And more often than not, that's a trochanteric bursitis or an iliotibial band syndrome. Remember that thin strap-like muscle that radiates downward from the hip down the side of the leg is a very, very important muscle. It's very thin, it's very susceptible to herniation, and that can cause referred pain down the outer aspect of the hip. And then, of course, this posterior hip pain, which very frequently can be caused by a piriformis muscle syndrome or gluteus medius, gluteus maximus muscle strain or sprain. It can even be caused by a discogenic problem, something occurring in the spine, a nerve problem that's occurring at the level of the spine, which radiates down the back of the hip and causes a referred pattern of pain. So the clinician has to be mindful of all these possibilities. Let me also add that it's also very important to look for non-musculoskeletal causes for pain.